ABFAS Practice Test 2026 American Board of Foot and Ankle Surgery Podiatry Exam Questions and Prep. Question 1. Which bone is the most proximal in the medial longitudinal arch? Calcaneus, talus, navicular, medial cuneiform. The calcaneus forms the base and most proximal part of the arch. Question 2. What is the primary indication for a Keller bunionectomy? Young patient with high IMA, geriatric patient with limited activity, athlete with hallux valgus, pediatric flatfoot. The Keller is a joint destructive procedure best for older, less active patients. Question 3. Which nerve is most commonly compressed in tarsal tunnel syndrome? Sural nerve, deep peroneal nerve, posterior tibial nerve, saphenous nerve. The posterior tibial nerve passes through the tarsal tunnel. Question 4. A Lees-Franz injury involves the joint between talus and calcaneus, tibia and talus, midfoot, cuneiforms/cuboid, and metatarsals, femur and tibia. Lees-Franz injuries affect the tarsometatarsal joints. Question 5. What is the gold standard for diagnosing osteomyelitis in the foot? Plain X-ray, bone scan, bone biopsy, physical exam. Histopathology and culture from a bone biopsy are definitive. Question 6. Which antibiotic is typically used for MRSA in skin infections? Penicillin, vancomycin, amoxicillin, cephalexin. Vancomycin is the classic treatment for MRSA. Question 7. A Jones fracture occurs at which location? Base of the first metatarsal, neck of the fifth metatarsal, base, zone 2, of the fifth metatarsal, shaft of the tibia. Jones fractures occur at the metaphyseal-diaphyseal junction of the fifth metatarsal. Question 8. Which test checks for Achilles tendon rupture? Lockman test, Thompson test, ankle drawer test, Mulder's sign. A positive Thompson test, no plantar flexion on calf squeeze, indicates rupture. Question 9. Which structure is the primary stabilizer of the medial ankle? ATFL, CFL, deltoid ligament, spring ligament. The deltoid ligament provides robust medial stability. Question 10. What is the most common cause of heel pain in adults? Calcaneal fracture, plantar fasciitis, gout, tarsal tunnel. Plantar fasciitis is the leading cause of subcalcaneal pain. Question 11. Which grade of ankle sprain involves a complete ligament tear? Grade 1, Grade 2, Grade 3, Grade 4. Grade 3 involves complete rupture and instability. Question 12. Charcot neuroarthropathy is most commonly associated with hypertension, diabetes mellitus, asthma, osteoarthritis. Peripheral neuropathy in diabetics often leads to Charcot joint. Question 13. Which procedure is used to correct a hammer toe? Arthrodesis of PIPJ, Lapidus, Akin, Evans. Hip joint fusion or arthroplasty is standard for hammer toes. Question 14. Mulder's click is a diagnostic sign for stress fracture, Morton's neuroma, sinus tarsi syndrome, hallux rigidus. Lateral compression of metatarsal heads produces a click in neuroma. Question 15. The windlass mechanism describes the role of the Achilles tendon in jumping, the plantar fascia in arch elevation, the peroneals in everschauen, the tibialis anterior in dorsiflexion. Extension of the big toe tightens the fascia and raises the arch. Question 16. Which imaging view is best for evaluating the sesamoids? AP, lateral, tangential, axial, oblique. Sesamoid axial views isolate the sesamoids under the first metatarsal head. Question 17. What is the primary action of the tibialis posterior muscle? Everschown, dorsiflexion, inversion and plantar flexion, toe extension. It is a powerful inverter and assists in plantar flexion. Question 18. In an ankle ORIF, which nerve is most at risk during the lateral approach? Sural nerve, saphenous nerve, deep peroneal, tibial. The sural nerve runs posterior to the lateral malleolus. Question 19. What is the normal hallux abductus angle, HA? 15 degrees, 20 degrees, 30 degrees, 45 degrees. Angles greater than 15 degrees typically indicate hallux valgus. Question 20. Which condition presents with morning pain that improves after a few steps? Stress fracture, plantar fasciitis, gout, neuroma. Post-static dyskinesia is a hallmark of plantar fasciitis.